I want you to imagine something for a moment. You have had a cough for 3 weeks. It is not severe. It does not hurt. You assume it is allergies, maybe a lingering cold, maybe the dry air in your home. You take some cough drops, drink tea with honey, and wait for it to pass. But it does not pass. And you notice something strange. The cough gets worse at night, especially when you lie flat. You start needing extra pillows just to sleep. One night, you wake up at 3 in the morning gasping for breath. Your spouse tells you to see a doctor. You say it is probably nothing serious. You wait another week, hoping it will resolve on its own like these things usually do. When you finally go to the emergency room because you cannot breathe lying down anymore, the diagnosis is not bronchitis. It is not a respiratory infection. It is not allergies or a lingering virus that everyone seems to have these days. It is heart failure. That ordinary sounding cough was your heart trying to warn you for weeks, and you almost missed it because it sounded so completely normal, so unremarkable, so easy to explain away. I am a professor of internal medicine with decades of experience teaching medical students, training physicians, and caring for patients over 65. I am not your personal physician, and this video is educational, not a substitute for individualized medical care from your own doctor who knows your specific situation and medical history. But I have seen this scenario too many times in my career. A cough that sounds completely normal gets ignored or explained away as something minor and turns out to be something far more significant than anyone expected. It happens more often than you might think. Today, I will teach you exactly how to recognize when a cough might signal heart problems, what specific warning signs require immediate attention, and what practical steps you can take to protect yourself and your loved ones from missing something important. Before we continue, I have a request. Leave a comment below with your age and where you are watching from. Tell me what symptoms concern you most, whether it is a cough, fatigue, shortness of breath, or something else entirely. Your comments help others in this community feel less alone, and they help me understand what topics matter most to you. If you find this information valuable, please like this video and subscribe to the channel. Now, let me start with a fundamental question that causes tremendous confusion among patients and even some healthcare providers. What exactly is heart failure? The name itself creates problems and unnecessary fear. Heart failure does not mean your heart has stopped. It does not mean your heart is about to stop. Heart failure simply means your heart is not pumping blood as efficiently as your body needs it to. Think of your heart as a pump. When that pump weakens or stiffens over time, it cannot keep up with the demands your body places on it. When this happens, two significant problems develop that affect your entire body. First, your organs and tissues do not receive as much oxygen-rich blood as they need to function properly. This is why people with heart failure often feel exhausted, weak, and short of breath during activities that used to feel effortless. Walking upstairs becomes difficult. Carrying groceries becomes challenging. Things you did without thinking now require rest breaks. Second, and this is the part most people do not understand, blood begins to back up in your system. When the left side of your heart cannot pump efficiently, blood backs up into your lungs. When the right side struggles, blood backs up into your legs, abdomen, and the rest of your body. This backup creates congestion throughout your system. Fluid leaks out of blood vessels into tissues where it does not belong. In your lungs, this fluid accumulation causes shortness of breath that worsens over time. And critically for our discussion today, it causes coughing that many people mistake for something else entirely. Heart failure can involve a weakened heart muscle that does not squeeze forcefully enough, called reduced ejection fraction. Or it can involve a stiff heart muscle that does not relax properly between beats, called preserved ejection fraction. Both types cause similar symptoms, including the cough we are discussing today. The critical point is that heart failure develops gradually over months or years. Symptoms appear slowly and subtly, which is exactly why people dismiss them as normal aging or minor annoyances not worth mentioning to their doctor. Now, here is something most people do not realize about coughing. A cough is not a disease, it is a symptom, and that symptom can have many completely different causes, each requiring different treatment approaches. In adults over 65, I commonly see three types of ordinary benign coughs in my practice that account for the vast majority of cases. The first is the upper airway cough from postnasal drip, allergies, or chronic sinus problems. Mucus drips down the back of your throat, irritates your airway, and triggers coughing as your body tries to clear it. This type is typically worse in the morning after mucus has accumulated overnight while you slept. It often comes with throat clearing or a tickling sensation that makes you want to cough. This cough usually responds well to antihistamines, nasal sprays, or treatment of underlying sinus issues. The second is the reflux cough from gastroesophageal reflux disease, or GERD. When stomach acid backs up into your esophagus and sometimes even reaches your throat, it causes a dry, irritating cough that can be quite persistent. This often worsens after meals, particularly large meals, or eating late at night when you lie down soon after. Lying down in general may make it worse. Many people experience this without classic heartburn symptoms at all. Doctors call it silent reflux, and it is surprisingly common. The third type is the medication cough, and this one is particularly important to understand because it affects many older adults. If you take an ACE inhibitor for blood pressure or heart protection medications with names ending in pril, such as lisinopril, enalapril, ramipril, or benazepril, you may develop a persistent, dry, tickling cough as a side effect. This medication-related cough affects a significant percentage of people taking these drugs. It is characteristically dry and feels like a tickle that will not go away no matter what you try. It can begin weeks or even months after starting the medication, which makes it harder to connect to the drug as the cause. Here is the crucial distinction. This cough is medication-related. It is not a sign that your heart is failing. If you experience this, discuss alternatives with your doctor. ARB's angiotensin receptor blockers provide similar heart and blood pressure benefits without this particular side effect. All three of these cough types sound normal and are usually benign, but there is a fourth type that can masquerade as any of these ordinary coughs, the heart failure cough. Missing it can have serious consequences for your health and quality of life. Research suggests that many patients with heart failure experience significant delay between when symptoms begin and when they seek medical attention. That delay can stretch weeks or months while the condition progresses unnecessarily, making treatment more difficult. Here are 5 specific clues that suggest a cough may be cardiac in origin, rather than coming from your airways or digestive system. Clue number 1. The cough worsens significantly when lying flat. This is perhaps the most important pattern to recognize and remember. When fluid accumulates in your lungs due to heart failure, lying down redistributes it throughout your lung tissue, triggering coughing. If you need progressively more pillows to sleep comfortably, pay close attention to this change. Track your pillow count over time. If you needed 1 pillow 6 months ago and now need 3 or 4, that progression is clinically meaningful information worth sharing with your doctor. Clue number 2. The cough wakes you from sleep with breathlessness. Heart failure can cause sudden episodes of severe breathlessness and coughing that wake you hours after going to bed. You may wake gasping, feeling like you cannot catch your breath no matter how hard you try. You might need to sit up or stand immediately to get relief. This is not a tickle in your throat from postnasal drip. This is air hunger, a desperate feeling that you cannot get enough oxygen while lying down. It can be frightening when it happens. Clue number 3. Wheezing develops without any history of asthma. Fluid in the lungs can cause wheezing. That sounds remarkably like asthma. It may even respond temporarily to asthma inhalers, which adds to the confusion. But if you have never had asthma in your life and suddenly develop wheezing alongside other symptoms we are discussing, consider that your heart, not your airways, may be the actual source of the problem. Doctors call this cardiac asthma, and recognizing it is important for proper treatment. Clue number 4. Unexpected rapid weight gain occurs over just a few days. Fluid retention has weight that shows up on your scale. 1 liter of fluid weighs about 2 pounds. If you gain 3 to 5 pounds or more over a few days without changing your eating habits, that is almost certainly not fat from overeating. That is fluid retention, and it may indicate worsening heart failure that needs prompt medical attention. Clue number 5. The cough travels with other symptoms rather than appearing alone. A heart failure cough rarely appears completely in isolation. Watch for swollen ankles, especially worse in the evening after being on your feet. Watch for fatigue that seems disproportionate to your activity level. Watch for reduced exercise tolerance. Walking or climbing stairs that used to be easy now leaves you winded and needing to rest. Watch for abdominal bloating or feeling full quickly when eating. When a cough appears with these companions, your body is sending an important message that deserves attention. Now, I must discuss emergency situations where waiting is absolutely not an option. Everything I have described so far involves patterns developing over days or weeks. These require prompt medical evaluation but can typically be addressed through your regular doctor. What I am about to describe is different. These are true emergencies requiring immediate action. Seek emergency care immediately. If you experience severe shortness of breath while sitting completely still, feeling like you are drowning or suffocating even at rest, this may indicate severe pulmonary edema requiring emergency treatment without delay. Seek emergency care if you cough up sputum that appears foamy, bubbly, or has a pink tinge to it. The pink color indicates blood mixing with fluid in your lungs. This is a medical emergency that cannot wait. Seek emergency care for crushing chest pain or pressure, especially if it spreads to your arm, neck, or jaw and comes with sweating, nausea, or breathlessness. This may indicate a heart attack requiring immediate intervention. Seek emergency care for fainting or near-fainting episodes, especially with rapid or irregular heartbeat. Seek emergency care for an uncontrollably racing, irregular heartbeat with severe breathlessness or dizziness. Call emergency services immediately in any of these situations. Do not drive yourself to the hospital. Minutes matter critically in these scenarios. For gradual symptoms developing over days or weeks without emergency features, schedule a thorough evaluation with your doctor. Come prepared to advocate clearly for yourself and describe what you have been experiencing. Here is what to discuss at that appointment to make sure nothing important gets overlooked. Request a complete medication review. Ask specifically whether you are on an ACE inhibitor and whether your cough could be medication-related rather than something more serious. If it is, alternatives like ARBs or newer medications called ARNIs may be appropriate for your situation. Discuss whether diuretics might help your situation. These water pills help your body eliminate excess fluid that may be accumulating. Ask about BNP or NT-proBNP blood tests. These measure substances released when heart muscle is under strain. Elevated levels suggest your heart is working harder than it should be, which provides important diagnostic information. Ask about an electrocardiogram to check your heart's electrical activity for any abnormalities or signs of previous damage. Ask about a chest X-ray to look for fluid accumulation in your lungs or heart enlargement that might explain your symptoms. Ask about an echocardiogram. This ultrasound of your heart shows how effectively it pumps and whether your valves function properly. If heart failure is suspected, this test is absolutely essential for proper diagnosis. Ask about sleep apnea evaluation. Substantial evidence links sleep apnea to heart failure. Each condition can worsen the other. If you snore loudly or wake gasping for air, a sleep study may provide important information about your health. Be persistent and clear in communicating with your healthcare team. Your doctor cannot read your mind or know what you have been experiencing unless you tell them. If something feels different in your body, say so explicitly. If you believe you need a particular test, ask for it, and ask why if it is declined. Certain conditions
Hello,
increase
I'm
heart
calling
failure
to
risk
schedule an appointment.
significantly.
I've noted a new
Be
symptom
especially
and would like to
vigilant
have it
about the
checked as
warning
soon as
signs we
possible.
discussed. If you have coronary artery disease or a previous heart attack, high blood pressure, even if it is currently controlled with medication, diabetes, atrial fibrillation, valvular heart disease, or chronic kidney disease. Any new symptoms in people with these conditions deserve prompt attention rather than waiting to see if they resolve. Now let me give you a practical home monitoring system you can start using today. This is not about diagnosing yourself, that is your doctor's job. This is about gathering objective data that helps your medical team make better, more informed decisions about your care. Monitor your weight daily using the same scale. Weigh yourself every morning at the same time, after using the bathroom, wearing similar clothing each day. Record the number somewhere you can track it over time. A gain of 2 to 3 pounds in one day, or 5 pounds in a week, likely represents fluid retention rather than true weight gain. Contact your doctor promptly if you notice this pattern developing. Keep a symptom diary that you update regularly. Record how you slept each night, any nighttime coughing or breathlessness you experienced, the number of pillows you needed to sleep comfortably, whether you noticed ankle swelling, your energy level throughout the day, and any limitations on your usual activities. After a week or two, patterns will emerge that you might never have noticed otherwise. These patterns provide valuable information for your healthcare team. Check your ankles every evening before bed. Press gently but firmly on your ankle bone for several seconds, then release and observe. If an indentation remains visible for more than a few seconds, you have pitting edema fluid retention in your tissues that may be significant.
If you found this
Also
helpful,
notice if your
please
socks are leaving
like
deeper
and
impressions than
subscribe.
usual,
And
or if your shoes feel
subscribe.
tighter than they used to. Track your exercise tolerance over time. How far can you walk before needing to stop and rest? How many stairs can you climb before becoming significantly winded? If these numbers are declining over weeks or months, that trend represents clinically significant information worth discussing with your doctor. Bring all of this collected data to every doctor visit. Objective information recorded over time is far more valuable than trying to remember how you felt weeks ago. Let me address some common misconceptions that lead people to ignore warning signs until problems become more serious. Some believe fatigue and breathlessness are simply inevitable consequences of aging that everyone experiences. While aging does produce certain changes in the body, severe persistent fatigue and progressive breathlessness are symptoms with identifiable, often treatable causes. Do not resign yourself to unnecessary suffering by assuming nothing can be done. Some assume their symptoms are just allergies acting up. But allergies do not cause ankle swelling. They do not cause rapid weight gain from fluid retention. They do not typically wake you in the middle of the night gasping for air. Some insist they are not really short of breath, just out of shape from not exercising enough. But breathlessness from heart problems often develops so gradually that people fail to recognize the change. You stop taking stairs, telling yourself the elevator is more convenient. You stop walking longer distances, telling yourself you are too busy. You may unconsciously avoid activities that trigger breathlessness without recognizing that you are doing so or why. Some believe a normal annual checkup rules out heart problems completely, but standard checkups with a stethoscope and blood pressure check can easily miss early heart failure. Concerning symptoms may require specific testing like an echocardiogram or BNP blood tests that are not part of routine examinations. Some hear the words heart failure and immediately assume it means imminent death. This is simply wrong. With appropriate treatment medications, lifestyle modifications, careful monitoring, many people with heart failure live active, meaningful, fulfilling lives for years or even decades after diagnosis. Early detection matters enormously for outcomes. For the coming week, consider following this simple approach to become more aware of what your body is telling you. Days 1 and 2, begin daily weight and symptom tracking. Simply observe and document your baseline without trying to change anything yet. Get a sense of where you are starting from. Days 3 and 4, make a comprehensive list of all your medications, including doses, and when you last refilled each one. Include over-the-counter medications and supplements as well. Days 5 and 6. Pay deliberate attention to your sodium intake. Read nutrition labels on packaged foods. Notice which foods in your regular diet are particularly high in sodium content. Day 7. Take a hard look at how you sleep. Count your pillows. Really notice. Do you feel different lying flat versus propped up? If you cannot get comfortable without stacking pillows under your head and chest, write that down. That information matters. Count exactly how many pillows you use to sleep comfortably. Notice consciously how you feel lying flat compared to when you are propped up at an angle. Continue all prescribed medications throughout this process. Do not stop anything without explicit medical guidance from your doctor. Engage in gentle physical activity as your body comfortably tolerates. At week's end, you will have valuable objective data for your next doctor visit. You will be prepared, informed, and ready to participate actively in decisions about your own health. Your body communicates with you constantly throughout every day. It sends signals, some obvious and impossible to ignore, others subtle and easy to overlook. With conditions like heart failure, early warning signals are frequently quiet. They develop gradually over time. They disguise themselves cleverly as normal aging or minor inconveniences. A cough that sounds ordinary but follows the specific patterns we discussed today may actually be your body delivering an important message that deserves your attention. Your responsibility is to listen carefully, observe systematically, and convey that information to healthcare professionals who have the training and tools to help you. You deserve to feel well. You deserve clear answers when something in your body changes. You deserve a medical team that takes your concerns seriously and investigates them thoroughly. You are never overreacting by asking questions about your health. You are never wasting anyone's time by requesting appropriate diagnostic tests. You are advocating for yourself exactly what every informed patient should do. If this information was valuable to you, please share it with someone who might benefit: a spouse, a sibling, a friend, a neighbor who has mentioned similar symptoms. Subscribe to this channel for more evidence-based health content designed specifically for adults over 65 and those who care for them. Leave a comment below with your age, where you are watching from, and what symptoms concern you most. I read every comment and use them to guide future content. Thank you sincerely for your time and attention today. Take care of yourselves out there. Your body knows when something is off. Trust that instinct. And please, if you are worried, pick up the phone and call your doctor. That is what we are here for. Now, I have to say this clearly. I am not your doctor. This video is meant to educate, not to diagnose or treat you. For your own specific situation, you need to work with your own healthcare provider. And if you are having severe symptoms right now, trouble breathing, chest pain, anything that feels like an emergency, stop watching and get help immediately.